Hi, if you or anyone you know is either uninsured or underinsured, you're going to want to watch this video. So, hi, my name is Nurse Liz. Also, my real name is Liz Pivito, and I am here to talk to you today about an amazing program that I found called Connect MD. And I affectionately call it, this is just my term, I call this gap coverage. So, who is this perfect for? So first of all, it is not insurance, but it is healthcare coverage. And it is great for someone who perhaps is like me, who has insurance, but I have a really high deductible and a high copay. It also might be good for somebody who doesn't have any insurance at all. So I am going to be talking about what it covers and what it does not cover here during this presentation. So I'll be answering all those questions for you today. So let's get started. I'm going to share my screen. Just give me just a second. I am going to share my PowerPoint. All right. Let me get that shared from the right view. Okay. All right. Make sure that you guys see me and see my screen. Okay, good. All right. So unless you've been living under a rock, you know that it has become a very common thing for people to not be able to afford their health care, right? It really just, you can read the screen. This isn't new information to any of us, but um, what makes me sad is when I hear about people who are having to choose between buying groceries and paying for medication, or buying groceries and seeing the doctor. So as an emergency room nurse, quite often what would happen is people would end up in the emergency room and end up with a bill of $1,000, $2,000, $3,000 for something that they didn't get taken care of because they couldn't afford to get it taken care of. For example, someone with a sore throat didn't go to the doctor, let it go, let it go, let it go, finally ends up in the emergency room with what's called a peritonsillar abscess, where the tonsils are literally abscessed, meaning a really, really bad and dangerous infection. So something that didn't get taken care of because of money ends up being an emergency situation that ends up costing a lot of money. So our program can help fill that gap, help meet that need, help people, real people, be able to afford access to healthcare. So that's what this program is about. I don't want to hear about anybody having to skip medications. Our program offers discount healthcare and discount free and or discount medication. So it definitely meets those needs. So let's talk more about it. So what does this program cover? Let's just jump straight in. So what this program offers is we have 3 different programs, and I'll talk more about all of them, but every program offers 24 hours a day, 7 days a week access to urgent care doctors via telehealth, meaning you put in a request, you log into, once you become a member, you log into your membership portal, which I have done. Does it work? Yes, it works. I logged in, made a request, had a visit the very first day I joined as a member. So let's start there. You log into your portal, you make a request. An average of 16 minutes later, a physician will either call you on the phone or video conference you through their system. Okay, that's how it works. So every single membership covers urgent care 24 hours a day, 7 days a week, anywhere in the United States. You as a member, you will never be charged for that urgent care visit. And most of the prescriptions that they will call in, if you need a prescription, will be free, because your membership, all memberships come with let me see if I can find mine, with a membership card. Okay, so it works like any prescription card. So just works just like any other prescription card. I wasn't ready, but here it is. I printed mine off. So I can go to any pharmacy in the United States, give them my uh, prescription card, and the medications will be either free or at a discount. Now, not every medication in the world, of course, but a lots and lots of medications will be free and or discounted with our membership card. So I can't tell you exactly what medications, but of course there are medications that are not going to be on the plan. Because we have so many members, we have over 350,000 members right now. We have buying power. So at the more members that sign up, the more discounts we're going to see, the more advantages, the more programs are going to be added to these memberships. Okay, so again, the urgent care is telehealth. And again, I can tell you from experience as a previous emergency room nurse that most people that come to the emergency room don't need to be in the emergency room. Of course, there are people who need to be there. They were in a car accident, they broke their leg, they are having a heart attack, their appendix is whatever. There are a lot of people, but on an average day with me working in the emergency room as a triage nurse, I can tell you from experience that, yeah, it's 80% or more people that could have been taken care of on the phone or on a video call or in a doctor's office or urgent care. So treating illnesses on the phone and on video is a very safe and affordable thing. Now, I will say, of course, if it's an emergency where you need to be seen in the emergency room, guess what? Our doctors are going to say, you need to go head on over to the emergency room. So we're not going to do anything dangerous with this program. So yeah, there's that. So let's keep going. So again, zero cost urgent care for members, zero cost behavioral health counseling for different packages offer different things. I'll talk more about that just a second. There can be zero cost dermatology depending on which package you buy. So again, yes, this is a real deal. Yes, 300. Okay, let me pause. Let me pause for a second because this program is just now being released to the public. Okay. Since it started in 2019, and from 2019 until this year, 2024, it was only available to businesses. So they offered this to businesses who had only a small number of employees and couldn't or did not offer insurance to their employees. This was offered as a service to small businesses to offer their employees as a alternative to insurance. So that's how we have so many members. Most of those members are members through their place of employment. Okay. So yes, it works. There are hundreds of thousands of people that are using this every single day. I've personally used it. It absolutely does work. So again, let's talk about a few more member benefits. So with the top plan, you can choose that's what I have for me and my family. I should have said this from the very beginning, and maybe I did, and I'm not remembering. Whatever plan you choose, it's a flat fee every single month, and it covers up to 7 additional people including yourself. So 8 people total in your family. So who can be on your plan? It could be yourself, a spouse, and any children that are under the age. I can't remember if it's 24 or 26. I am sorry. I believe it's 26, but it could be 24. Anyway, the website will tell you exactly. So it has to be a dependent child that's living in your home. So back to this screen. Primary care medications, already talked about that. This is something I'm super excited about. So just this week, we just added several new services that are added on to every program. So in addition to the telehealth portion, we now offer dental, vision, chiropractic, and medical supplies. I'll show you the slides for each of these. And these are not telehealth. These are, you can't do dental work via on the phone. So all of this, what you will receive, it just launched this week. I do have if you join as a member, you will receive a card, and then you will receive access to the website where you can search for a provider, call them, tell them you have the coverage that's stated on your card. It'll be different depending on which state you live in. It's different programs that our company has contracted with, but you'll get a real card, and you'll call them and say, hey, Dr. Smith, I have such and such card. What kind of discounts am I going to receive through your practice? So it's going to be different depending on your demographic area and your provider. So that's why this is just kind of a generalized blanket discount on all of these slides. So dental is going to be somewhere between 15 and 50% off. Vision is going to be somewhere between 10 and 60% off, depending on what services you use. Chiropractic is going to be between 20 and 40% off, depending on the provider, what they have agreed to. And then medical supplies. Now, I have visited this website myself just to check it out. And most of the medical supplies that are offered on this website are supplies for their diabetic supplies. Okay. Our company also offers virtual pet care. One thing I would like to say about this program is it is not pet insurance. So let's start there. It is pet advice. So read this down here where it says 24/7 care. It says no diagnosis, treatment plan, or prescription will be provided. So they will give you advice and education, but they will not diagnose or treat. Coming very soon, sometime in the next 4 to 6 weeks, hopefully they're gonna release a separate membership that will be called the Fit membership. And it was GLP-1 medications. So they will be compounded. They will not be the name brand, but the cost will be under $375 a month total. That will include your doctor's visit, your prescription that will be via mail order called into you. If you want more information about that, you just need to get with the person who invited you to watch this video and let them know you want to be notified as soon as that is available. Okay, so let's talk about the 3 different memberships that are available. I do have the Platinum membership, which I think, it's not that much more per month. So why not get the membership that has everything in it? So in addition to your monthly membership fee, you are going to pay a $30 enrollment fee. So there is that. I want to say that up front. So the $59 silver package offers the urgent care and acute medications at 0 cost, so 90% of those. And then if for medications that are not on that urgent care list, it's up to 90% or up to 80% off. Very, very inexpensive. What I do want to say though, I can't remember if I said this earlier, when you become a member, your membership benefits become active same day, with the exception of a couple of things. You won't get your membership card for your dental, vision, and chiropractic with all the membership numbers on it and everything for at least a week. Okay, I don't know exactly how long that's going to take, but it's going to take some time to get your card in. Okay. And then with your prescription card takes between 2 and 3 business days to become active. So don't wait till you're sick to do this. Go ahead and get started on it, and then you can have everything ready for when you're sick. On that note, all of these memberships are on a month-to-month basis. You can cancel at any time. You can upgrade, you can downgrade, you can restart. So there's no long-term commitments with this. So that's what's covered. You also do get the discounts for dental, vision, chiropractic, and medical supplies on every single one of these plans. Okay, so the gold plan includes everything that the silver plan includes with the addition of 24 hours a day, 7 days a week, virtual counseling. And counseling can be anything from if you're not feeling happy, or if you are anxious about something, or if you want to talk to someone about budgeting. There is a list of all kinds of different things. You want to talk to somebody how to organize your home. There is a long list that's not just behavioral issues that you can talk to a counselor about at 0 cost, 24 hours a day, 7 days a week. Also in the gold package, 90% of the top prescribed mental health medications are covered at zero cost to you. So again, this would be a mail order thing, 3-month supplies. If you have a current prescription for it, your doctor would just need to use our pharmacy and call that in or e-scribe it in or fax it in, and then it'll be zero cost to you. If you do not have a prescription and you need a prescription or you need a refill, that's where you would need to use the Platinum to be able to have a primary care doctor or a psychiatrist call that in for you. Okay, so that's what's covered in the gold, is the addition of the mental health components. And then the platinum covers everything that the silver and gold covers, but it also offers virtual primary care, virtual dermatology, the Ask a Specialist feature, which there is a list of, I think, 16 different kind of specialists, like holistic doctors or pediatricians, where you can just write in like, you don't necessarily need to be seen, but you have a medical question. And so you can ask them questions 24 hours a day, 7 days a week. It takes them up to 48 hours to answer your question. So these are non-urgent things that you just want to ask somebody. It also included our free annual lab tests and diabetes kits. That free annual lab test is what's called a CMP, which means comprehensive metabolic panel. And so it's just the generic routine lab that checks your overall health. Chronic meds, this is a big one. This is where chronic meds are covered, 3-month supply at a time, for things like diabetes, oral diabetes medications, blood pressure medications, things like that. Things that you take every single day. Chronic health medications are covered at most of them, up to around 90% of medications that people take on a daily basis are covered at $0 to you. And again, everything that's covered in those other two plans. So this program is all about sharing and making sure that other people find out about it. So as a customer, they have a program where if you refer 3 of your friends or family to the program and they become they get any of the paid memberships, whether it be a pet membership, gold, silver, gold, or platinum membership, or when the fit membership becomes up, any memberships at all. If you have 3 friends that become paying members, then your membership fee becomes free every single month. So that's really, really cool. I don't know that this program is going to last forever, but for now, it's a really great deal. They also have what's called a agent opportunity. That's what I am. It is a commissionable program where if you refer people to this program, then you earn commissions off of every single person that you refer. So it's not the 3 and free thing. This is an agent opportunity. Okay. So the question is, what are you going to do? Do you want better access to healthcare? Do you need help with these issues? Do you know people that need help with these issues? Because if so, if any of this resonates with you, then ConnectMD can be the answer for you. So it's very simple. You have 2 choices if you want to join or you want to enroll. You can become a member only or a customer only, or you can become an agent with a membership to earn those commissions. Either way, what you need to do is you need to get back with the person that invited you to watch this video, because this is by invite only. So if you were to go to the website, the KMD website, it's going to ask you to put in the referring person's name. So it's very important that you give credit where credit is due. So either you go to the website, you put your referring person's name in, or even better, this is the best method, is you get back with the person who invited you to watch this video, and they will give you their referral link. So if you have any questions at all about any of this, you can get back with me or the person that invited you, or you can just ask in the comments down below wherever you're watching this video, and I will answer them. So thank you so, so much for watching. And that is that is all. Thank you, guys.